Foot and arches of the foot. The foot has two important functions. 1. Support the body weight. 2. Lever to propel the body forward in walking and running. To serve these functions, foot is made up of series of small bones and designed in a form of elastic arches or springs. Weight transmission. Functions of the arches. Help in proportionate distribution of weight. Weight distributed equally through the anterior and the posterior part of the foot. Heads of 5 metatarsals posses 6 weight-bearing points. Arched foot acts as a segmental level. Plantar concavity prevents compression of neurovascular structures of the foot. Arched foot is dynamic and pliable. Inverters and everters help in shifting weight distribution. Normal foot. Footprint. Arches of foot: medial longitudinal arch. 2. Transverse arch. Longitudinal arches. Medial longitudinal arch. Lateral longitudinal arch. 2. Transverse arch. Supports during standing. Plantar ligaments. Plantar aponeurosis bear maximum stress. Supports during locomotion. Muscles are active. Windlass action of plantar aponeurosis. Medial part. Lateral part. FDB. Flexor dig brevis. Flex dig longus. Flex hallucis longus. FDL. Abhal. Flex accessorius. Effixes. Lumbaricals. Long plantar leg. Peroneus longus. P. longus. Factors maintaining the arches. Shape of bones. Staples. Tie beam. Slings. Medial longitudinal arch. Summit. Trochlear surface of talus. Anterior pillar. Heads of medial 3 metatarsals. Posterior pillar. Medial tubercle of calcaneus. Vulnerable part of arch. Head of talus, keystone. Characteristic feature of arch. Resiliency. Factors maintaining medial arch. Shape of bones. Wedge-shaped bones. Keystone, head of talus. Staples. Plantar ligaments. Most important: plantar calcaneonavicular, spring ligament. Tie beam. Plantar aponeurosis, abductor hallucis, flexor hallucis longus and brevis tendon, medial part of flexor digitorum longus and brevis. Slings. Tibialis anterior tendon, deltoid ligament and tibialis posterior tendon. Lateral longitudinal arch. Summit. Subtalar joint. Anterior pillar. Head of 4th and 5th metatarsals. Posterior pillar. Medial tubercle of calcaneus. Vulnerable part of arch. Calcanea cuboid joint. Characteristic feature of arch. Rigidity. Factors maintaining lateral arch. Shape of bones. Calcanean angle of cuboid maintains upward tilt of calcaneus. Staples. Long and short plantar ligaments. Tie beam. Plantar aponeurosis, abductor digiti minimi, flexor digiti minimi brevis, lateral part of flexor digitorum longus and brevis tendons. Slings. Peroneus brevis, peroneus tertius and peroneus longus. Transverse arch, anterior transverse arch, posterior transverse arch. Is formed by heads of the 5 metatarsal bones. Is complete. Posterior transverse arch. Is formed by greater parts of tarsus and metatarsus. Is incomplete, only the lateral end comes in contact with the ground. Factors maintaining transverse arch. Shape of bones. Wedge-shaped cuneiforms and bases of middle 3 metatarsals. Staples. Deep transverse ligaments, intrinsic plantar ligaments, dorsal interossei, oblique and transverse heads of adductor hallucis. Tibium. Tendons of peroneus longus and tibialis posterior. Slings. Peroneus brevis and tertius laterally. Tibialis anterior tendon medially. Applied anatomy of foot. Plantar fasciitis, inflammation in the plantar fascia ligament, pain in the heel and arch, worst in the morning, are symptoms. Osteoarthritis of the feet, wear and tear cause the cartilage to wear out. Pain, swelling, and deformity in the feet. Gout, an inflammatory condition causing severe pain and swelling. Big toe is often affected. Athlete's foot, a fungal infection of the feet, causing dry, flaking, red, and irritated skin. Rheumatoid arthritis, an autoimmune form of arthritis that causes inflammation and joint damage. Bunions, hallux valgus, a bony prominence next to the base of the big. Diabetic foot infection. Diabetics are vulnerable, such as redness, warmth, swelling, and pain. Swollen feet, edema, can be normal after prolonged standing, common in people with varicose veins, can also be a sign of heart, kidney, or liver problems. Calluses, a buildup of tough skin over an area of frequent friction or pressure on the feet, usually develop on the balls of the feet or the heels and may be uncomfortable or painful. Corns. Corns consist of excessive tough skin buildup at areas of excessive pressure on the feet, typically have a cone shape with a point, and can be painful. Heel spurs, an abnormal growth of bone in the heel, which may cause severe pain during walking or standing. Ingrown toenails, one or both sides of a toenail may grow into the skin. Ingrown toenails may be painful or lead to infections. Fallen arches, flat feet, the arches of the feet flatten during standing or walking. Nail fungal infection, onychomycosis, fungus creates discoloration or a crumbling texture in the fingernails or toenails. Nail infections can be difficult to treat. Malatoes, the joint in the middle of a toe may become unable to straighten, causing the toe to point down. Irritation and other feet problems may develop without special footwear to accommodate the mallet toe. Metatarsalgia, pain and inflammation in the ball of the foot. Strenuous activity or ill-fitting shoes are the usual causes. Claw toes, abnormal contraction of the toe joints, causing a claw-like appearance. Claw toe can be painful and usually requires a change in footwear. Fracture, the metatarsal bones are the most frequently broken bones in the feet, either from injury or repetitive use. Pain, swelling, redness, and bruising may be signs of a fracture. Plantar wart, a viral infection in the sole of the foot that can form a callus with a central dark spot. Plantar warts can be painful and difficult to treat. Morton's neuroma, a growth consisting of nerve tissue often between the third and fourth toes. An neuroma may cause pain, numbness, and burning and often improves with a change in footwear. Hammer toe. A hammer toe occurs when a toe bends down at the middle toe joint, metatarsophalangeal joint, causing the middle toe joint to be raised slightly. There may also be a deformity at the distal interphalangeal joint. Claw toe. Claw toe often affects all toes at the same time, except the big toe, causing them to bend downward at both the middle joints and the joints nearest the tips so that the toes curl down. The toes bend up at the joints where the toes and the foot meet, MTP joint. Mallet toe. A mallet toe often affects the longest toe, generally the second toe, but it may affect the other toes as well. The toe bends down at the joint closest to the tip, dip joint. Talipes dash. Congenital deformity of the foot, usually marked by a curled shape or twisted position of the ankle, heel and toes. The most common is known as congenital talipes equinovarus, CTEV, or clubfoot. The 4 different forms are Talipes equinus, Talipes calcaneus, Talipes valgus, Talipes varus. Bes cavus. Deformity characterized by an abnormally high medial longitudinal arch. Pes planus. 3 ways in which the Achilles can rupture are: pushing off on the weight-bearing foot while extending the flexed knee, for example out of the blocks in a sprint, or jumping. Suddenly and unexpectedly dorsiflexing the foot, which would happen when stepping into a hole. Violent dorsiflexion of the foot when it is plantar flexed, such as in falling from a height. Usually person feels sudden pain in the heel, and may mistakenly think they have been shot or kicked in the heel. Will have weakness when plantar flexing. Thomson test. Squeezing the calf as shown will plantar flex the foot, black dotted line, if the tendon is intact. There will be no movement with Achilles tendon rupture. Walking cycle. Propulsive mechanism of the foot. In walking, transmission of weight borne by the foot is successively transferred along the heel, lateral border in the ball of foot and anterior pillar of the medial longitudinal arch and medial 3 digits. Increase in the height of medial arch by windlass action of plantar aponeurosis. Extension of great toe causes elongation of FH and FDL, which increases the force of subsequent contraction. Both long and short flexor muscles of toes increase the force of takeoff. Prevention of buckling of toes is done by lumbricals. In running, heel remains above the ground. Takeoff point is maintained by the anterior pillar of the medial longitudinal arch. Walking cycle. A person makes about 1,700 to 1,800 foot strikes in every mile. The average man walks 70,000 miles in his lifetime. It consists of series of swing and stance phases in succession. Swing phase, when the lower limb is off the ground. Stance phase, the foot strikes the ground and bears weight. Walking cycle, the period from the heel strike of one foot to the heel strike of the same foot. Bobbing, head is displaced upward twice in stance phase, by alternate uses of lower limbs and undergoes corresponding downward movement in swing phase. The amount of vertical displacement is about 5 centimeters. During locomotion, lateral displacement of 5 centimeters is evident when viewed from front or behind. In swing phase, a person bends the trunk to the side on which he stands for balancing. The trunk displacement is reversed when the other lower limb bears the weight alternately. Simultaneously, the arm undergoes alternate forward swing with the opposite leg. Sequence of movements in walking cycle. In first part of swing phase, hip, knee and ankle are flexed. The limb then begins to extend and is fully extended until the heel of the advancing foot strikes the ground. Hip flexors are most active during the early part of the swing, and the hip extensors are maximally active at heel strike. Dorsiflexors of the foot are active at the beginning of swing phase to clear the foot from the ground, and after heel strike to prevent it from slapping the ground. Sequence of movements in walking cycle, Kent. At the beginning of stance phase, the knee flexes slightly when the weight is fully borne. It again undergoes full extension at the end of the stance phase. Foot is then bent at the metatarsophalangeal joints. Plantar flexors of the foot are most active during the later half of stance. The toes tend to flex and grip the ground during the same period. Long extensors and intrinsic muscles of the foot stabilize the toes and provide fixed origins for the long flexors and extensors to act on the leg. Inverters and everters of foot are important stabilizers in stance phase. Sequence of movements in walking cycle. In first part of swing phase, hip, knee and ankle are flexed. The limb then begins to extend and is fully extended until the heel of the advancing foot strikes the ground. Hip flexors are most active during the early part of the swing, and the hip extensors are maximally active at heel strike. Dorsiflexors of the foot are active at the beginning of swing phase to clear the foot from the ground, and after heel strike to prevent it from slapping the ground. Control and regulation. Walking is a laboriously learned and automatic activity. It depends upon the reflex patterns mediated by the spinal cord and controlled by the brain. Walking reflexes are regulated by a variety of sensory informations of tactile, ligamentous, articular and musculotendinous nerve endings. The pattern of walking may be altered by individual style, poor posture, overweight, footwear, etc. Disturbances of gait are important signs in many disorders of the central nervous system. Disturbances of gait: ataxic gait, hemiplegic gait, scissors gait, staggering gait, waddling gait, cerebellar gait, propulsion gait, limping gait. Multiple choice questions. The arrow mark structure is the tendon of Q. 1. The arrow marked structure is the tendon of A. Peroneus brevis, B. Peroneus longus, C. Tibialis anterior, D. Tibialis posterior. Q. 2. Which of the following ligaments supports the transverse arch? A. Long plantar ligament, B. Short plantar ligament, C. Deep metatarsal ligament, D. Plantar aponeurosis. Q. 3. The keystone of the lateral longitudinal arch is A. navicular, B. lateral, cuneiform, C. calcaneum, D. cuboid. Q. 4. Medial longitudinal arch of the foot is not formed by A. cuboid, B. calcaneus, C. talus, D. navicular.